Hey guys, it's Dr. Daniel Sugai, board certified dermatologist. Welcome to my channel. I do medical, surgical, and cosmetic dermatology. I see patients every day. I'm diagnosing skin cancers all year round, treating skin cancers, and I'm also seeing patients making mistakes that will lead to worse outcomes, whether it's skin cancer, rashes on the face, not using your products correctly and getting into trouble. We're gonna be talking about common skincare mistakes that I'm seeing in clinic. I really wanna spread the awareness around these topics because I feel like it's very important. People are seeing bad information online, lots of misinformation. This is why I created the Sugai Academy for other healthcare professionals to join in on social media and make credible content and really become an expert in your space. I feel like this has really helped me in clinic being on social media by knowing what is out there, what kind of content my patients are consuming, and being a voice, a trusted voice online. And so thank you guys so much for watching my videos. I'm having so much fun here on YouTube, and I'm gonna keep making these videos, releasing them every Saturday. So let's jump into it. We'll be talking about 5 skincare mistakes today. And the first mistake I'm gonna have to say is not using your sunscreen appropriately. Dr. SPF, I love talking about sunscreen, but I'm seeing way too many patients nowadays who are making the mistake of only using sunscreen when they go to the beach, the pool, or only during the summertime. Right now it's really sunny and hot in Seattle, and that's when people are busting out the sunscreen. We're actually supposed to be wearing sunscreen all year round, even on cloudy days, because UVA radiation, those rays will penetrate through clouds, through window glass. So you should be wearing sunscreen every day to protect yourself from UVA. You can tell on your app, the UV index, it can be a really high UV index of 10 on a cloudy day because you're getting a lot of UVA still penetrating and hitting the Earth's surface. We're gonna be exposed to the damaging effects of UVA, which can really go down into your collagen, your second layer of skin called the dermis, and chew up the collagen, make your enzymes chew up the collagen, leading to wrinkled, saggy, not elastic skin. And you also will be affected by UVB, causing discoloration and other photoaging of the skin. Not fun, guys. And both can lead to skin cancer. Now, the other thing people do is they go outside after wearing one application of sunscreen. They're playing outside or walking outside and they're getting a sunburn, especially in Hawaii. UV index is crazy high in Hawaii because it's right on the equator. Why? Because they are not reapplying sunscreen. So be sure to reapply sunscreen every 2 hours when you're going out for a walk. If you're outdoors watching a baseball game, wear sunscreen. I've had a patient recently who said, man, I got a really bad burn. I wore sunscreen, but it wasn't water resistant and I went out for a run. Instantly, they said the sweat just made the sunscreen disappear. They sweated off really quickly and got a really bad burn where their nose peeled. They had little miniature blisters under the eyes. So be very careful, wear water resistant sunscreen. Now, it's not gonna say waterproof, sweat proof. It's going to say water resistant on the label when you look at your sunscreen. It's either going to be 40 or 80 minutes. So if you're in the water or you're sweating continuously for 40 minutes and it's a water resistant 40-minute sunscreen, you're supposed to reapply every 40 minutes. Same for 80 minutes. If you're in the water in the pool, my kids are wearing the 80-minute Blue Lizard sunscreen. I'm telling them, get out of the pool now at 80 minutes. You're going to have to reapply, towel off, and then reapply. And that's when they like the sticks. They really like the sticks from Neutrogena, Cetaphil, or CeraVe. Those are really quick, nice application for them. I don't have to chase them around. Also, Blue Lizard makes some nice sensitive and active sprays that are zinc oxide based that come out like a mousse. So it's not like spraying and being very heavily aerosolized. It's actually a nice viscous texture to kind of paint on their back and rub on very easily. I don't feel like I'm breathing in all these aerosolized fumes from the sunscreen. So check those out for your kiddos for reapplication. You could also just use a UPF shirt that will block out 98% of UV rays if it's UPF 50 plus, and you don't have to worry about reapplication or waiting for 15 minutes for the sunscreen to set before jumping into the water. So consider those. I've now adopted some good UPF shirts for the pool and the beach. Number 2, oh gosh, this one's a tough one. The UV index on your phone is meant to give you indications of how the UV rays are impacting the Earth's surface, how it's reflecting in your particular location. It's giving you a number, and it's actually supposed to give you an indication of how strict you're supposed to be with your activities, your clothing, your sunscreen use. So after a UV index of 4 to 5, you're gonna be in the high territory of UV index. And I'm seeing a lot of patients who are looking at 9 to 12 UV index as a time to really go outside, when really we're supposed to be avoiding the sun or being very strict with our sun protection with you know, broad brimmed hat, UPF clothing, and sunscreen, because you don't want to just protect with a hat or an umbrella, because a lot of the UV will be reflecting off either water, concrete, sand from below and still affecting you. So you got to wear sunscreen in addition. But people are using it for the wrong reasons. They're saying, oh, I can get an efficient tan. If the UV index is at 9, I'm going to go outside and tan my front and back. I'm seeing so many videos online of young patients doing it. My own patients here in clinic are coming and saying this. They're like, oh, don't worry, doc, I'm wearing sunscreen, but I really want a tan. I'm not getting a burn, don't worry. But I just want to say that having cumulative sun exposure like this without a burn doesn't mean that you're not going to get skin cancer. Yes, you can still get skin cancer because squamous cell carcinoma is related to cumulative sun exposure. But yes, blistering sunburns can increase your risk of melanoma, but also just having these bursts of intense sunlight will also cause DNA disruption, DNA damage, because a tan is actually a manifestation of your skin crying for help, saying, stop, I need to take a break from all this trauma, from this radiation. The goal isn't to tan to look healthier. You can go outside and be healthy and be active, but protect your skin. If you're seeing the UV index being at 9 to 12, you should actually consider staying indoors. I'm never a big supporter of staying indoors with the windows all blocked up. Go outside, be healthy. But the whole thing about vitamin D, I need my vitamin D, you only need to be outside for 10 minutes for you to get the daily dose of vitamin D from the sun. The sun is not a good, consistent source of vitamin D. I would rather have you focus on supplementation and diet for vitamin D, because there are studies that show that people in Hawaii and Australia, surfers and skateboarders, still get vitamin D deficiency. So not a reliable way of getting vitamin D. And also going to the indoor tanning booth, they're using UVA primarily. You need UVB to start that vitamin D production from the skin. So tanning booths will not help with your vitamin D levels. Also, getting a base tan before vacation. I've been seeing a lot of patients who are going on summer vacation, they want that tan. That base tan does not help. That's going to damage your skin further. It only provides an SPF 4 to 5 at most. So don't think that's going to protect you for your Hawaii vacation. So no base tans. The only tan I'm okay with is out of a bottle. So self tanners, those are fine. Okay, Jergens is a very popular brand that I trust. It doesn't cause contact dermatitis like some other really fragranced and irritating self tanners I've seen for some patients. Rather have you do that than getting a tan outside. Now next would be giving up on your retinoid too early. I have had patients who said, hey, I stopped my tretinoin because I'm not seeing any results after a month. Just wanted to let you know, setting expectations for these skincare products we talk about online. Retinoids can take 2 to 3 months for it to work on your acne. For example, the Roche-Posay Effaclar Adapalene Gel. This one is Adapalene 0.1%. You can find this over the counter, but it does take 2 to 3 months for it to work on your pores, unclogging pores, keeping them clean. Just keep that in mind. For hyperpigmentation, I say at least 4 to 6 months you have to use your retinoid consistently. Say a retinol, you have to use it consistently. Same for my tretinoin that I prescribe in clinic, that's prescription. You gotta stay with it. If you wanna work on fine lines and wrinkles, over 6 months. 6 months or more, that's the rule there. Keep going with it. It's a marathon approach, not a sprint. And also, you're giving up too early, but also not knowing when to quit is another mistake I see, where you have rosacea and you're trying to use, say, Adapalene or retinol over the counter, like Avens Retinol that has retinaldehyde in it. That's stronger than retinol. That you just have to be very careful if you have rosacea. You have to understand that you gotta take things slow, and you have ultra sensitive skin when you have rosacea. And also if you have perioral dermatitis, I'm having patients throwing on retinoids over that because they saw, oh, it must work on acne. Perioral dermatitis is a variant of rosacea. It's under the category of rosacea. Putting a retinoid over it, I've seen people just flare and get deeper acneiform bumps around their mouth. So just knowing when to stop. Some people can't tolerate retinoids, and we'll talk about at the end of the video how to use a retinoid properly, because that's another mistake, is people aren't using it correctly. So setting expectations, don't quit too early, but also knowing when to quit if you have rosacea or perioral dermatitis. Next would be not protecting special sites when you're outdoors. I'm seeing patients with skin cancers on the ears, the lip, around the eyes, and the scalp. Very common areas for skin cancer now. I'm seeing it more than ever. Also the upper forehead near the hairline. People maybe aren't wearing sunscreen up to the hairline. They're also not protecting with a hat or a cap. So for protecting your scalp and that forehead area near the hairline, wear a hat or a cap. Wallaroo, thank you for the hats you've sent me for my family. They have UPF material. Great for blocking out, like we said, 98% of UV rays. If you want to use like Sunbun products, they are good with the sprays. So if you want to have a spray for your part, that's where I'm finding a lot of skin cancers in women, is that right near the part, even pre-skin cancers. For males, I'm seeing at the vertex or the crown, skin cancers there because that's where we bald. So be sure to get sunscreen there, and the sprays have been very popular amongst my patients. For ears, a broad brim hat to protect, but also getting sunscreen there is really important because having a squamous cell carcinoma here, the scalp, the lips, those are high risk areas, not just recurrence after we treat it, but also metastasis, moving into deeper structures like lymphatics. So we really worry about those areas. And I feel like the skin cancers grow faster there. People really neglect the ear when it comes to sunscreen application. So this is a huge reminder, wear sunscreen on your ear and also on the anti-helix ridge as well, because I'm finding skin cancers there. Now when it comes to lip sunscreens, very hard to find lip sunscreens, and you don't want to just put your regular sunscreen on your lips because it's not meant to be ingested. But there are good lip sunscreens out there like EltaMD, their UV Lip Balm is good. Aquaphor has made a good lip protecting sunscreen that my MAs like to use. But if you are sensitive to beeswax, those have beeswax in it. So I'm on the hunt for other lip products that do not have beeswax. Mdsolarsciences, their lip balms do not have beeswax. And also OneSkin, that brand that has made good peptide containing sunscreens, have a lip product out that does not have beeswax, so that's good. Keep an eye out for that one. I'm really looking forward to trying that one out soon. Protecting your lips, because this is a very tough area, especially the lower lip, to reconstruct, and also a high risk area. Around the eyes, wear your sunglasses and wear your sunscreen around your eyes. I know some sunscreens can bug your eyes and irritate your eyes, your eyelid skin, so maybe stick to a zinc oxide or zinc and titanium dioxide sunscreen for around the eyes so it doesn't sting your eyes. Great ones we've talked about on the channel. Vanicream, stick sunscreens like we talked about with Neutrogena. Those don't run as much into the eye with sweating. Another one could be just CeraVe or Cetaphil. Those are all good. And then one of my favorites would be Blue Lizard's. You know, their sunscreen's good, the sensitive SPF 50. Just know, protect those areas. Lower eyelid, if you get a skin cancer there, I'm diagnosing that all the time. It's really hard to reconstruct there, and you can affect the way your tears are drained, and you can get this thing called ectropion after the surgery for repairing the lower eyelid. Not good long term, so guys, please protect your skin now. Lastly, using retinoids incorrectly. Using a retinoid is a special thing. We're so lucky to have retinoids because it works on fine lines and wrinkles, your pores, keeps them clear, works on dark spots by increasing cell turnover. But the big thing to do is using it correctly by using just a pea-sized amount at bedtime. Sunlight can deactivate a lot of retinoids. I always say use at bedtime and just use a small amount. What do I mean by that? Just a pea, just like that. This is a huge mistake I've seen people do. I'm seeing people put a pea all along their face on TikTok, and that's just asking for trouble. Whether using my prescription tretinoin or an over-the-counter Adapalene, that's way too much. So what you're gonna do is break it up into two, dots on the face, you can go around the mouth, and then connect the dots. People always say online, that's not enough. But I promise you, this is enough to cover these areas. I would stay outside of the orbital rim. You want to treat around the eyes within the orbital bone, use a dedicated eye retinol cream like Rox, okay? That you can consider. But everything else, keep it outside of that orbital rim. But what happens after that? You're gonna apply a moisturizer. Have oily skin, CeraVe's PM lotion is nice and lightweight. If you have more dry skin, Cicaplast Balm by Roche-Posay is a thicker one, but don't use too much because this will clog up your pores. So just a very small amount to seal that all in, and then go to bed. During the day, wear your sunscreen. That is the best way to use a retinoid. And if you're very dry, you can even moisturize first and after your application of retinol. That's called the retinol sandwich. Hope this video is helpful. Please hit the like button. Please subscribe to the channel. Please share with your friends who are into skincare. And thank you guys for hitting that bell notification and joining me every Saturday for these new long form videos. Hope you're all enjoying the summer weather out there, well protected with your sunglasses, your hat, and sunscreen. Take care and peace.